Hepatitis delta is an interesting virus because it needs hepatitis B to complete his life cycle. Especially the S antigen is important so that the virus can be released and can infect new cells. Everybody believed up to now that a cell must be first infected with HBV and then get super infected with HDV. And it was uncertain if HDV can survive in a mono-infection setting. We therefore ask ourselves if HDV can in vivo persist and then after several weeks can be rescued by HBV to generate a productive infection again. We use a specific mouse model, it's the UPA SCID mouse, it's an immunocompromised mouse, and it allows us to transplant human liver cells. And you can see it here. The mice were injected with human liver cells and they engraft in the liver and produce such clusters. And these cells within these clusters, they are highly differentiated and therefore they can be infected by hepatotropic viruses such as HBV and HDV. Exemplary shown here. So every cell after 10 weeks of infection get HDV or HBV infected. We could show that even 6 weeks after HDV mono-infection, you can still see HDV positive cells. So we ask ourselves, is this virus still vital? And therefore, we super-infected the mice now with HBV. And as you can see here, is that we now can detect HDV viremia. This results show that HDV can survive, HBV comes, and then HDV gets released. And you can nicely see it here that we now see plenty of cells which are positive stained for HBV and HDV. We could show that HDV mono-infection creates a latent infection and that the virus can survive for up to 6 weeks. This is important in patients with low HBV replication so that HDV can persist, which was a paradox for several years. And it's very important for patients post-transplant because if HBV replication is not very much suppressed, then there is a high risk that HBV-HDV comes back, which puts the patient to a big risk.